Hello, my name is Adrienne Crowder. I'm the manager of the Wellington Guelph Drug Strategy. Today it's going to be my pleasure to introduce you to some of the great work we're doing in our community. I look forward to introducing you to 4 different projects, each of which the drug strategy has led and each of which is making positive change. You'll meet the Drug Treatment Court, the Stay Sharp Needle Exchange, the North Wellington Coalition for Youth Resiliency, and the Patch for Patch project. Let's go.
I'm Norm Douglas. I'm the criminal court judge here, full-time criminal court judge in Guelph. I've been doing this job in Guelph for nearly 20 years. And I preside over the Ontario Court of Justice, all criminal matters in Wellington County. Every day on my list, on my criminal court list, there are people who've committed crimes because they're trying to support their drug habit. I mean, a lot of our criminal cases, I don't know how many, anecdotally I would say probably 75% of them have got something to do with either abuse of alcohol or abuse of other drugs. The difference between drug treatment court and the normal criminal court is like night and day. Because they're in the program for such a long period of time and I meet with them every week, I get to actually know these people. I know their backgrounds. I know what's making them tick. I know what their problems are. I know what their triggers are, which is something that doesn't happen to me in ordinary cases.
My name is Mary Catherine Keating, and I work as an addictions counselor at Community Addiction Services, but in the drug treatment court, I provide the counseling. The key therapeutic advantages for clients of the drug treatment court are access to services that can communicate with one another easily, frequent, like weekly counseling, a more personal and informal relationship with the court, and increased accountability for their behavior.
The drug treatment court is designed to take some of these drug-addicted people who are committing other crimes to support their habit, the spin-off crimes, the break-and-enters, the thefts, the frauds, to try and get them address the drug addiction, which in turn will stop the spin-off crimes. In a nutshell, that's what it tries to do.
The gains I've seen clients make in drug treatment court is they become more willing to make changes in their use and the related behaviors. There's longer periods of stability, so that gives the brain a chance to heal. And there's a decrease in criminal activity and more awareness of its impact.
The drug strategy really coordinates all the different players on the team. Right now, there's probably upwards of a dozen, 10 to 12 people on the drug treatment team.
The police, the education system, the courts, the addiction system, probation, welfare, everybody, right? And so it's really a really remarkable way that it started grassroots and it's grown.
My name is Allison Vasey, and I am the Community Youth Resiliency Worker for North Wellington specifically. So the North Wellington Coalition was kind of a brainchild between a bunch of different partners up in North Wellington, and it came out of the Wellington Guelph Drug Strategy Prevention Summit, and it was identified that youth in North Wellington have a high susceptibility to substance misuse and mental health concerns. So partners kind of thought that this was the time we finally need to come together and start really addressing those issues for our youth. Key themes that were identified were transportation, lack of employment, lack of ability to get their 40 volunteer hours, lack of recreation, and just lack of places to go to be a kid, to be a teen, to relax with your friends. A lot of these small towns are very sidewalk communities, and they shut down by 6 o'clock at night, and there's really nothing for them after those hours. So a lot of them are spending time hanging out with their friends with nothing special to do. And that's where we get into trouble, and that's where we start to see those vulnerable characteristics and those vulnerable decisions that come out with using drugs or drinking or other risky behavior choices that we see them choose. It's been very easy almost to get youth to be on board with this project. A lot of them are just so hungry for something they can get involved in up north. There's no youth councils, there's very few youth groups, and if they are, they're connected specifically to a faith-based organization, so they're not necessarily for the whole. So for these youth, they just want to belong to something. What we're doing in the next 3 years is going to be a huge help for prevention for these youth and finding ways to keep them involved in positive activities and making positive choices in their community.
I'm Lisa McEachran. I've been a community pharmacist in Guelph for 25 years, and I've been chair of the Guelph Pharmacists Association for 10 years. For the last year and a half, I've been the community pharmacist on the Wellington Guelph Drug Strategy Committee, and part of that committee is a working group for prescription drug use. Part of the Wellington Drug Strategy Committee's tasks was to implement the fentanyl patch for patch policy. What that is, it's a policy whereby used patches are returned by the patient to the pharmacy rather than being disposed of. The reason for that is there is a lot of active drug left in the fentanyl patch after it is expired as far as the medical use goes, and that used patch can be and has been abused and has caused some significant problems in the region. Fentanyl is a very, very potent opiate. It's an extremely effective pain reliever, but it can be very dangerous in overdose or when used inappropriately by someone who is not familiar with opiates, and it can cause death and has caused deaths. The way the patch for patch process mitigates risk in the community is by getting the patches back into the pharmacy where they can be disposed of in an environmentally safe manner. The reason for that is sometimes when patients are on the fentanyl patches, members of their family or social group may know they're on the patch and they're aware of the black market for use patches and they will take them without the patient's knowledge. Sometimes it's the patient themselves that may be misusing the patches. So by getting them out of their hands and off the streets back into the pharmacies, it's one less avenue for abuse. We have had a couple of patients that have really pushed back against the program, and that's been an important growing and learning experience for us and for the physician as well, because in one case it did underline a case where the physician had doubts about the patient using the patches properly anyway, so it just outlined already what she kind of had thought and then put that person on a path to getting their addiction treated and working with them that way. The other instance was a case where the physician nor us at the pharmacy had any idea this person was potentially abusing the patches, and it was a real eye-opener for all of us to realize that it's not always the person you think it is that may be misusing the patches. So it just underlined how important it was to have everyone bringing back their patches and to have every physician in town online with this program and not just pick and choose what patients you're going to have bring the patches back. The Drug Strategy Committee, one thing I think they've done that's really important is open people's eyes to the fact that there may be a problem and that it's not just someone else's problem. It's society's problem and it's our whole community's problem. Therefore, we all need to work together to help these people and come up with a productive, constructive way of dealing with things rather than a punitive way.
My name is Rochelle Devereaux, and I'm the Director of Programs and Services here at the Guelph CHC. As an organization, we have housed the drug strategy position for several years, and it's a partnership that we're really proud to have.
Hi, my name is Jen, and I am a peer outreach worker with Sanguine Health Center and the HIV/AIDS Resources and Community Health, known as ARCH. Over the last couple of years, I've been involved with the Harm Reduction Working Group, with an Outreach Networks committee, and I've sat on a few different tables to just sort of see what they have to offer and add what I can to the table.
So we have housed the Needle Exchange cupboard on behalf of the Stay Sharp program for several years now. Harm reduction is certainly a philosophy that the Guelph CHC acknowledges and welcomes within our service model. The model that the CHC was housing on behalf of ARCH was one that was an open access cupboard that was not staffed. When we think about a comparative model, that's quite similar to a vending machine model where the person doesn't have access to that face-to-face contact, but where also there's some missing elements of oversight and monitoring of the individuals who are coming to the space to access the supplies that they need.
I think the biggest changes that I've seen post-staffing model at the harm reduction cupboard when we were just simply doing outreach and more of a self-serve cupboard, and how we have it today is with the staffing model. I think the biggest piece is engagement. It's a really inviting space. People come in, they often sit down and have a snack, they share a little bit about what's going on in their day-to-day things or their lives in general. It gives us as staff a little bit more opportunity to engage the clients as far as referrals, referrals to primary care, referrals to addiction services, other agencies in the community. I think the big piece is engagement. I think the best part about having a staff model for my role is getting to know the other players in the field. It's really helpful. We can often give referrals based on names, or we hand out business cards. We know different agencies, but to put a human face to the agencies and the business cards we're handing out really helps me to be able to know who I'm referring to. So I think it's all about the community partnerships.
Harm reduction for all of our clients is all of our responsibilities, and that's something that the drug strategy has really been at the front end of communicating to the community. With that leadership, the drug strategy was able to bring together all of the partners who interface with that drug using community to really acknowledge that needle exchange is all of our responsibility. But in bringing together that group, what we were really looking at designing was a delivery model that saw face-to-face interaction and support for those who use drugs when they came to access the needle exchange supplies here at the Guelph CHC.
I think coming from the lived experience perspective, the drug strategy really helps to bring the community together. It's very empowering to see in all under one roof in a place like the Harm Reduction Forum, the amount of community agencies, of lived experience, of people working together for the same goal is extremely overwhelming. The first time I went to see the amount of wealth of organizations and of people who care in this community, and I think the drug strategy really does a great job of bringing all those people together for the common goal.
Thank you for joining me here today. I hope you've enjoyed learning about the important work that the drug strategy is doing. The four-pillar approach has proven itself to be an effective way of generating sustainable and creative answers to complex challenges. I'm going to leave the last word to Lisa.
The four-pillar approach, I think, benefits Guelph and Wellington by opening everyone up to the different ways of dealing with drug abuse and misuse in your community. That there is a justice way, there is an education way, there is a medical way of dealing with addictions, and it's by working all of those together that we're going to be the most productive.